In the name of Allah, Assalamu alaikum friends. Today I am present about morphine. Morphine is the drug of choice for analgesia because of its reliable and predictable effects, safety profile, and ease of reversibility with naloxone. Various doses are used. The dose is commonly treated until the desired effect is obtained. Now come to the history. About 1806, a German youth, Friedrich Saturner, isolated the primary active ingredient in opium. He tested the new drug on his friends at 10 times the modern recommended dose. Active agent was 10 multiply more potent than opium. He named it morphinum after Morphinus, the god of dreams. Now come to the pharmacokinetics. Orally absorbed very slowly. Extensive first pass metabolism 20% 40% of bioavailability. Duration of action 3 to 6 hours. Distribution is wide. Concentration in the liver, spleen, and kidney is greater than plasma. Morphine freely crosses placenta. Plasma half-life 3 hours and 1 to 5 hours. 30% is plasma protein bound. Pharmacokinetics extends to the mechanism of absorption and distribution of drug, the rate in which a drug effect beings along with the duration of the effect, the chemical transformation of the drug in the body, most likely the enzymes, and the effects and routes of excretion of the drug. Metabolism. The primary site metabolism is liver, where it undergoes rapid glycoronidation. However, extrahepatic metabolism up to 30% of its total clearance. Morphine 6-glucuride m6 gram, as potent as morphine, has a half-life of approximately 1 and 2 hours. Mechanism of action. Morphine is considered the classic opioid analgesic with which other painkillers are compared like other medication in this class. Morphine has an affinity for delta, kappa, and mu opioid receptors. Administration. Morphine administration can occur through various ways. Its administration is most often via the following routes: early, intravascular, epidural, and intrathecal. Now come to the monitoring. The efficiency, the therapeutic index of morphine are assembled with a combination of subjective and objective findings. Controlling pain, which is usually the first symptom evaluated in patients, is the unlimited goal of morphine use. Now come to the morphine uses. Morphine is used medicinally, relief of moderate to severe pain in both acute and chronic management, preoperative sedation, and to facilitate the induction of anesthesia. For long-term treatment of terminally pain-ridden patients. How should this medicine be used? Morphine comes as a solution liquid, as extended release long acting tablet, and as an extended release long acting capsule to take by mouth. The oral solution is usually taken every 4 hours as needed for pain. MS contain brand and Ervimo ER brand are extended release tablets that are usually taken every 8 or every 12 hours. Morphine brand extended release tablets are usually taken every 12 hours. Korean brand extended release capsules are usually taken with or without food every 12 hours or every 24 hours. Adverse effects. Among the more common unwanted effect of morphine use is constipation. This effect occurs via stimulation of opioid receptors on the meningeal plexus, which in turn inhibits gastric emptying and reduces peristalsis. Other common side effects include central nervous system, depression, nausea, vomiting, and urinary retention. Now come to the intrathecal adult dosage. A single injection of 0.2 to 1 milligram painful relief for up to 24 hours. A constant intravenous infusion of naloxone hydrochloride 0.6 milligram and half for 24 hours. After intrathecal injection may be used to reduce the incidence of potential side effects. Now come to the side effects of morphine: meiosis, orthostatic hypotension, respiratory depression, pain suppression, proteus, histamine release, hormonal release, increased intracranial tension, nausea, aporia, sedation. Contraindication. Now come to the points of contraindication: respiratory depression, hypersensitivity, paralytic ills and delayed gastric emptying, obstructive airway diseases, acute hepatic diseases, MAO inhibitor administration, pregnancy, lactation, and in children. In medicine, a contraindication is a condition of factor that serves as a reason to without a certain medical treatment due to the harm that it would cause the patients. Contraindication is the opposite of indication, which is a reason to use a certain treatment. Interactions. Morphine will not be effective in people taking naltrexone. It can increase the sedative effect of alcohol, increase the risk of respiratory depression when used with MAO inhibitors and cimetidine. It antagonizes the effects of diuretics. Phenytoin, a potent synthetic opioid analgesic with a rapid onset and short duration of action, a strong agonist at the opioid receptors. Phenytoin, also spelled fentanyl, is an opioid used as a pain medication and together with other medication for anesthesia. Fentanyl is also used as a recreational drug, often mixed with heroin or cocaine. It has a rapid onset and its effects generally last less than 2 hours.